I'm super happy to have like those 4 incredible people here. Sonia, as I already said, she's on Foresight's board. She has an incredible VC called 100 Plus Capital, who has been sponsoring our late longevity efforts, which we're super grateful for. And she's really focusing on a quite like holistic approach to aging, in the sense that she cares a lot about like the environmental factors that may kind of like hamper or may extend our ability to live a long, healthy life. Then Ole, I'm really happy to have you here. I think Niels, I only met him at the previous Foresight Longevity investment takeoff that we had, but I'm really happy to see that Europe is going so strong in terms of focusing on actively funding really promising aging companies with a pretty ambitious, I think, financial backing. So thanks for doing that, and I can't wait to hear from you more about the European side of this, even though you do a ton in the US as well. Then Reason Man, I think I could just get lost on FightAging. It's a fantastic blog, and you really go into every aspect, from the very transhumanist futurist angle into why ought everyone care about this topic. Apart from that, you also have a fantastic biotech company, Repair Biotech, which you presented at a previous Foresight meeting last year. And I linked to all of those talks from the Slack. So if you're not on the Slack yet, then this is a really good time to join the Slack and to introduce yourselves in the introduction. Reason and Ola are already on there. I'm hoping more people will join. And yeah, it's really good discussions over there already. And Aubrey, of course, I think, you also really don't need an introduction. I think I looked at lifespan.io recently, and I think you're on a panel also tomorrow or something on a similar topic. So I think, you've been...
I don't have it written down. Okay.
Yeah. Well, here's my reminder to you.
Oh, so yeah, you're quite right. Yep, tomorrow.
Yeah.
22 hours from now.
Every day is the same, isn't it?
Yeah. Well, it's a good time to be onboarding new people into this, I think. So thank you for joining us today. We had Jim O'Neill from SENS yesterday here, who was setting the stage quite nicely. And I think even SENS on your homepage on the forefront, you give a really good introduction into the relationship between COVID and aging. So maybe we should kick off there and really start talking about, and I would love to hear from any of you, first of all, for anyone who's really not up to speed, what do we mean by fighting aging as a root cause of many diseases, and what specifically is the relationship between COVID-19 and aging? Why should we care about this? Why are we talking about this right now? Would anyone care to tackle this? Please raise your hand from the panelists. Otherwise, I'll pick on someone.
That's an Aubrey question, if I heard one.
Yeah, that's an Aubrey question.
Okay, Aubrey, you go.
Well, so I think really the main thing is that over the course of the entire history of civilization, we have formed an incorrect intuition about the relationship between the thing we call aging and the various things that we call diseases. We have seen that there are certain ways in which people's health declines, and some of those things happen early in life and some of them happen late in life, but all of them happen to some people and not to other people. And the specific things that happen, even if they tend to happen late in life, tend to happen at a relatively wide variety of ages. Whereas there are things that feel a little bit more kind of amorphous and poorly definable, general decline in energy and stuff like that, which seem to happen at a somewhat narrower window of ages. So it kind of has engendered this feeling in humanity that there is this dichotomy between, on the one hand, things that we might be able to actually do something about with medicine because some people don't get them anyway, as opposed to this other thing which is so universal and so predictable in terms of when it happens that it kind of feels different. It feels inevitable and it feels like natural and like maybe it's even off limits to medicine. So what we're all about, really, in this community is disabusing humanity of that incorrect impression that has built up over thousands of years, and therefore it's a bit difficult to change people's attitudes about this. But the fact is, we know easily enough at this point about the nature of physiological decline, both mental and physical, to be able to say unequivocally that there is no such distinction in terms of actual meaningful biological terms. So really, I feel that the main problem here is getting people to believe in research. At the moment, there is, I think, among most members of society who are not scientists, there is a kind of mixed message that they have in their heads with regard to research. On the one hand, they know that everything relies on research in the end. Progress happens because of pioneers. But they also know that progress in research is extremely unpredictable in terms of how long it's going to take to actually deliver results. And this particular field that we are in is, of course, one which, precisely because people don't like getting sick, has attracted a lot of people who are willing to be over-optimistic and to exaggerate the impact of things that can already be done, or of things that they say can be done in the near future. We have to distance ourselves from that, while at the same time not becoming fatalistic about it. And that's just a really hard circle to square. I think that's really what it all comes down to.
Aubrey, I think aging is a little bit like germ theory. You can't see it, right? I mean, when germ theory first came along, it took a long time to convince some people that it existed, that these things called germs existed. And I think aging is sort of the same way, where, like you say, you don't see it right away. You can't see aging happening over time because it's creeping up so slowly that, it's kind of similar. And so maybe there's some lessons to be learned. We should go back and see how the germ theorists did it.
Yeah, that's part of it. I agree, Sonia. I think of course, some of the diseases of old age, in fact, most of the chronic conditions of late life are also relatively slow as compared to, for example, your typical early onset infectious disease. So, there's a continuum there, but you're totally right. I think the strategy of going and looking at how paradigm shifts successfully happen, and especially how paradigm shifts happen successfully and relatively rapidly, those are definitely big lessons we can draw from.
So, I mean, what I would like to the second part of the question, what is the relationship between COVID-19 and aging? I mean, if you look at the people who are dying from COVID-19, you will see that in Italy, the average age of the people who died was 79.5 years. In Germany, it was even over 81 years, the average age of the patients. I mean, there were also people dying with 60, so there also have to be people who died at 90 or something like that. And I mean, this is clearly because their immune system doesn't work anymore. And I mean, one part of what all of us are doing is that we want to rejuvenate the immune system. And if you would have these technologies on hand now, or if you would have them already, not so many people would die from COVID-19, right? And I think this is also a message that we should spread after COVID-19. And we can I think we can make a very big point here. So these people, I would say, these people didn't die from the infection. They died because they were old and we didn't care to rejuvenate their immune system. And I think this is something Reason can add a little bit to it, because I mean, he's actually doing that with his company.
In New York City, I think there's something north of 90-something% of hospital admissions for COVID were people with comorbidities, which is sort of, a short.
In Germany, this number is over 99% of the people who died from COVID. They were not only old, they had one age-related disease, at least one age-related disease. 50% of them 4 or more age-related diseases. Sorry, Reason.
Indeed, and we know that quite aside from the immune system falling over and dying horribly, which is actually something that would happen in your 30s if you were unfortunate enough to be one of those people who had your thymus removed as a child before they figured out that was a bad idea. It's also that you're frail, that you don't have resilience. that you have a higher burden of baseline chronic inflammation, and this disease apparently murders you by excessive immune activation and inflammation, which is probably a more horrid thing to have to undergo when you're at the point where you can't resist it so well. You might also look at why sepsis is a disease of old people primarily, and many of the same underlying problems in both immune failure and lack of resilience at the same time, which of course, if you follow the SENS view of aging, these all stem from the same forms of underlying damage that spread out in a tree of dysfunction. I would say that I'm here in exile in upstate New York, and as a consequence of that, most of the people I know are, if not the salt of the earth, shall we say, somewhat more salty than this present exalted company. And amongst their number, most are young, and most are personally scared of COVID-19 for their own health. The fact that old people largely get this, the fact that there are old people around that maybe they should be thinking about quarantining because of that, no, that's not why they're doing this. They're doing this because the media is trumpeting the few young people that die, and to their eyes, it's a threat to them. That's why people are people out there in the world who don't have our perspective on things. That's their view of this condition. Aging really isn't on their agenda, just the same as it's not in their mindset every year when influenza goes around, because it's just an inconvenience to them.
You speculated a little bit as to the reasons for that, and I think a recent blog post that you made, could you maybe go back to that, or could you just once and for all enlighten people, hey guys, those are the comorbidities that we're talking about, this is the relationship, just to keep it crystal clear.
Any comorbidities. I mean, when somebody says a person has a comorbidity, that's really just shorthand for saying they are old and have a chronic disease. But in the US and some other parts of the world now, that can also be shorthand for not so old and morbidly obese. There was a particular news article a month ago that some of us were talking about, where some healthy young woman in one of the middle states in the US was on the news because she died of COVID-19, and the actual description of her was a healthy younger person, and they showed a picture, and this woman was 300 and something pounds, if anything, so it's a problem.
Yeah, and I think Kuyan has been banging on about that particular problem, I think, and that may even be more like a behavior shift that we can induce in people, rather than just focusing on age-related technology and science as well. Okay, so do you think that we've covered everything on what you myths that you'd like to bust around COVID-19, and why actually aging is an underlying factor to consider there? Do you think we've covered that all, or would you like to hammer that point in more?
Unless anybody wants to talk about specific mechanisms beyond your immune system is aging, but those are definitely out there. You can go read up on them.
Where would people do that?
That's actually a good question. Resources are, you might search for immune aging on FightAging, and that will give you a good selection of reading material. But basically, the thymus involutes your hematopoietic stem cells that are responsible for creating blood and immune cells go a little weird and stop working quite so well. Your immune system gets cluttered up with gunk, which is to say malfunctioning, damaged, stressed cells of various sorts that are causing more harm than good. And there's also a side effect of that is you get increasing autoimmunity, where your cells start to attack you rather than other things as well. And those are the primary ones. There's other little odds and ends around the edge, but if we could deal with those, then things would look a lot better.
I think Reason had a good point too, that the media have really, the way that they've been reporting on it has sort of made people not really understand the crisis the way it actually is. And there's a lot of people who are scared who don't necessarily need to be.
Yeah, I agree. So why do you think, Okay, I think that media analogy is actually like a really good step point into the the next question that's also on the doc, which is why do you think that we are so blind to recognizing aging as a crucial cause for disease? And I think Aubrey talked about that a little bit already, but I think supposedly, right, from a healthcare perspective, there must be huge benefits for doing healthcare instead of sick care later, from a financial perspective, right?
Mm-hmm.
So what's going on? Aubrey, I'm going to unmute you too because you can't.
I mean, I'm happy to start here because I've thought a lot about this problem. So because so I have a background in tech. So I was a tech entrepreneur for 10 years and was investing in tech companies. And I was just wondering if you see how much money is going into the tech space. I mean, if you use a fraction of that money for our space, for the aging space, I think we would already live five years longer on average, right? And so I was wondering why there is so little money in that space. And I think it's basically 5 reasons for that. I mean, people are really denying that it is possible to rejuvenate people or to slow aging. And some people even get aggressive when you tell them it is possible. And I think it's a psychological thing. First of all, it's a very young industry. So people are trying for hundreds of years, if not thousands of years, to find something that is keeping them young, and they didn't accomplish anything. And only in the last 15 years, we really know what are the root causes of aging and what kind of problems we have to solve to not age anymore. And then we have like accelerating technologies or catalyzing technologies like CRISPR-Cas, which were coming out in the last years, or AI. And I mean, a lot of things were only found recently. For example, I mean, Nobel Prize for the discovery of autophagy was only given 2016. Of course, the research was earlier, but I mean, now it's only recently that we know that this is possible. Then a second reason is, which is also a problem for the FDA and the European Health Administration to get trials approved, is that we have a Christian-Jewish tradition in the Western world. And in the Christian-Jewish tradition, we are saying aging is coming from God, so thus it's not a disease. So we can't classify it as a disease, which is very hard. I mean, it's changing now with the TAME trial and the work of Nia Barzilai and also others. I mean, Aubrey also plays a role here, and of course, Reason with his blog. So there are people who are making pressure on the World Health Organization and also on other institutions. And then I think that people are inherently afraid of highly innovative technologies because they see in them a provocation to God. And I think this is also deeply etched into our cultural consciousness. So, I mean, if you look at theater plays from the Greek, I mean, more or less all these plays are going about hybris and then the fall. And so what we think when we use highly innovative technologies, you can see that, for example, when the first airplanes came out, people thought that we elevate ourselves to the sphere of God, and that we are punished by God for doing this. And I mean, we still have the strict security rules when we go into an airplane, which not make sense really, but we are sticking to these rules because we show with these rules that we are small, that we are obedient, and somehow we try to get the mercy of God to be not penalized for really going physically into the sphere of God. I think this plays a role. And I mean, think about all this catastrophe movies from Hollywood. It's all about hybris and then fall, yeah, because we try to elevate ourselves to the sphere of God. Then it's also dissonance theory. So death, of course, is a highly negative associated thing, and people don't like to think about that. So it's really easy to get rid of these thoughts by saying, so we can't change it, we can't do anything here. So it's really easy, then we don't have to think about it. And I mean, to solve aging is really one of the hardest problems out there. But people prefer not to be involved in negative emotions. So because of dissonance theory, they just, and I think this is also the reason why some people become aggressive when you tell them that it's actually possible to rejuvenate people or to slow aging, because they don't want to think about that. This is negative for them. And so they just want to spare it out. And then it's also a problem, kind of a problem of the ist-ought problem described by David Hume, so that people think what is natural is good. So the naturalistic fallacy. So, I mean, in the darkest times of our history that lead to the idea that, for example, people who are disabled less worthy than people which are not disabled. But we also think because aging is a natural thing, it's also ethically or moral good that we die. But of course, this doesn't make sense. Only we as humans decide what is good and what is wrong. Yeah, and but I think these are the reasons why so many people doubt on what we are doing and think that it is a bad thing to rejuvenate or slow aging.
I have a slightly simpler take on it, which is that one, the regulators have the biggest microphone. Therefore, everybody is only going to understand aging in terms of the fact that there's a bunch of diseases that have nothing to do with each other, and everybody's only allowed to talk about that. Secondly, I think that nobody believes that the world changes to a first approximation. And even the people who believe that the world changes in these sorts of select groups, if you ask them to write science fiction, they will write the same science fiction that most other people write, which is looking the future which is today in just different clothing. We live in a time of immense, rapid, enormous change, and people have already forgotten they didn't have cell phones 30 years ago. And if you ask them to write a 2050 story, it will be cell phones with different paint jobs. So nobody really believes that the world changes at all. They think they live in this era of biotech and massive communication and all these wonderful things happening, and they think they're going to die on the same schedule as their grandparents, and they think their life is going to be the same as that. It's very strange, frankly. It's sort of this cognitive dissonance that people manage to maintain.
I think they're also scared of change too. When they start thinking about radical change, humans in general don't like change all that much.
Mm-hmm. Quite true. So there's these two things where people think they live in a static world, and the messengers of the static world, the broadcasters, are basically saying, they say nothing about aging, and they say everything about age-related diseases. And because the world does not change, cancer research, we've always been at war with Oceania in terms of cancer research. It's not a disease that will ever be cured. Ask people about this. Do they believe that there's going to be a cure for cancer, or is it just that cancer research is a good thing that everybody should give to, and that is the steady state of the world, that we're on this journey that will never ever go anywhere? And I think that most people think this in their sort of the sideline of attention they give to the world, and people who think otherwise are rather different.
Yeah, I think the simple answer to the original question, why are we so blind, is that there are many different answers. The number one answer is a different one for different people. But I think it's perhaps useful to try to rank them in terms of popularity. And I feel that, in my personal experience anyway, there are probably three that are the biggest ones and the ones that we should focus on. And the ethical and moral aspects do not come in that top three, actually. People definitely will say things along the lines of, aging is natural, and death gives meaning to life, and so on. But that doesn't really hold them back. Similarly, the arguments for aging being a blessing in disguise, like where will we put all the people and how will we pay the pensions and so on. These things, the specifics are not really the problem. The underlying basis for those specifics, though, is one of the three things, and it is people are terrified of getting their hopes up. Yes, they're terrified. They have a fear of the unknown as well, but they have even more of a fear of getting emotionally invested in the idea that medicine is going to come along and stop them from getting sick when they get old, and then it doesn't. There's a terribly big one. The second one that I think is huge is that, in general, preventative medicine is very hard to sell, whether it's for early onset or late onset conditions, simply because people know that medicine in general is basically black magic, and that especially new medicines are experimental and could do more harm than good. And if you're not yet sick, then they could definitely do more harm than good. So people are not very good at, discounting and looking at the impact on one's future health rather than one's present health. And they tend to think that anything that you're supposed to take when you're not yet sick is probably a bad idea. So I think that's a huge part of it as well. But the number one, most popular one, for sure and certain, is people just don't think it can be done. this comes back to the thing I mentioned earlier, this incorrect dichotomy that people have in their heads between aging itself and the diseases of old age, as they call them. But really, the fact is it's a very deep-seated belief. And it doesn't matter how authoritative and credentialed the people are who come and say, listen, if this could be done, even slightly, then the world would be an incomparably better place. We would save this, trillions of dollars a year and so on. Even then, people will say, well, yeah, sure, but you can't do it, can you? Because aging is natural and it's not like diseases and so on. And so they just don't listen. They may be very polite, but they don't listen. So those are the things that we have to deal with. And maybe the only way to deal with it is just to plug away and get more and more small steps towards experimental success, even if it's only in the laboratory and not even in the clinic, so that it becomes more and more impossible to carry on believing that it actually can't be done.
Yeah, I mean, I think at one point, I think, first of all, the fable of the dragon tyrant by Bostrom is a good one, I think, because he's kind of like calculating out how much time we're losing by just not opting in. Because I think to some extent it's a chicken and egg problem, right? The more people opt in and believe that it could be possible, the faster we could work on it and the likelier it would get. On the other hand, people are so shit scared of opting in, because if they accepted how bad death actually is and then just fell short just right before actually, being able to extend their own life, that would be like, the biggest FOMO of your lives, basically, what you'd be opting into there. So I think, but there must be kind of like a cutoff point or a point at which, at least you could tip a few minds, into opting in. And I think it would be really nice if, I think we once talked about this on a different panel, but if we could create something, if we could get a lot of established scientists to say, okay, if XYZ happens, then we're quite confident, that people currently alive could, leapfrog their way into longevity, right? And if we had that cutoff point after which it would be safe for others to opt in, then maybe we could get enough investment going to even get to that cutoff point for when people's mental space, it's a little bit safer for them to opt in. But yeah, I mean, this may be too long in the future with the current speed at which we're flying away. But I think maybe to kind of like switch gears now that we know kind of like what's holding us back. Now COVID-19 came along, right? So what changed? What are kind of like different narratives that are available to us now? And what are, very specific kind of like data points that we can point to and say, guys, this is it. It's crystal clear right now. How do you think we could change people's minds right now? And have you already seen people updating?
Well, I've been doing a lot of work very recently. Obviously, I'm working on a restore the immune system in old people type of project. So we went out and looked at how the grant situation was changing because of COVID. And I can tell you that the grant system right now is a panic in the sense of make more masks immediately, here's some money. It has nothing to do with fundamental research per se. It may shake out in that direction eventually. I think we all expect there to be a whole lot more infectious disease research in the future, but that doesn't really necessarily mean that anybody will say anything about focus. If government funding organizations can be trusted on to do anything, it is all of the wrong things. And to give as much money as possible to whoever is great at lobbying, regardless of what they do. So I think it remains to be seen how that part of it shakes out. I don't know how the others have been seeing their part of this.
Well, I think part of COVID, I guess one of the silver linings is that it makes everybody realize we're all in the same boat, that we're all, right now we're all in a pandemic and we're all, death seems closer to everybody, even though it's not, we talked about this earlier, but death seems closer to everybody now. And now everybody is noticing it. I mean, most of us go around living our lives without interacting with the healthcare system at all, which, by the way, I think is also why the healthcare system is so screwed up, because you never ever look at the healthcare system until you actually need it. And by the time you need it, you don't have the energy to be an activist. And that's why there's nobody in there trying to fix the whole thing. But, now we're at this point where we're all kind of noticing that we have a collective health problem, and it's all the same problem. And in the same way, aging is a collective health problem. So, I mean, it's a health problem that's further off in the future, at least for young people. But I think this gives us an opportunity to sort of, okay, well, aging is the same thing. We all have this problem. We are all aging and we are all going to die from aging. And so maybe that can help.
To be honest, oh, sorry. Should I start or?
Go ahead.
Okay, so to be honest, so I mean, of course, we're also seeing a lot of grants that are giving out now by the government and institutions. But otherwise, I think that we have to focus on the aftermath, though, when COVID-19 is over, because so from my experience, everyone is in emergency mode right now, and they just try to fix the COVID problem, and they are not open for new ideas. I think that the real work is coming after the crisis, and then people will listen.
Yeah, I think that's a very important point, Ole. At the moment, it's just not possible to get the real attention of the major decision makers because they're too focused on the near term, and so they should be. But there will come a time, and we must not miss this boat, when decision makers turn their attention to how to be more prepared and more preventative in the future. And that's the point where we absolutely need to get on top of this. Now, actually, related to that, I want to come back to something that Reason said maybe 20 minutes ago, which alarms me a great deal with regard to what he's seeing in upstate New York with regard to why, what young people are scared about. If it is in fact true that young people have this on their minds mainly because they have an exaggerated sense of their own vulnerability, then, that's not so good. I'm rather hoping that the reason why the lockdown orders around the world have been so widely adhered to is not that, but rather that people in general are actually caring about each other, and in particular are caring about the elderly. If it turns out that that's actually the case, that most populations are doing this largely for altruistic reasons, then we've got a starting point with our discussions with policymakers and decision makers from which to say, this is the public showing by their actions, not just by words or opinion polls or whatever, that the elderly matter and the health of the elderly matters, and therefore that it is something that's electorally sensible to actually allocate more money to research to keep people healthy late in life.
I think one would have to do a larger survey than my informal, hey you, why are you not meeting up this week? Survey of upstate younger folk. So I think one of the things we would have to ask ourselves about this whole COVID business is, how is this any different from all the things that have failed to wake people up in the past? Like cancer or the infinite money thrown at heart disease awareness. What is it about this that's going to do something? I mean, both Aubrey and I have been through any number of publicity exercises and advocacy exercises, and I think we both noticed that there really doesn't seem to be a great deal of correlation between what you do and success in any way, shape, or form. You can get on national TV and have nothing happen as a result, right? So it's a very difficult thing to sit here and say, okay, let's use this to advantage, because once you get past about a couple of decades of watching people trying to do this and thinking of past efforts such as the nanotechnology horrible experience from the first decade of this century and other such things where it all went horribly wrong in terms of trying to get funding for the right projects and trying to get people's attention to go to the right areas of forward-looking research and fail miserably. It's a tough road, I think.
Yeah, I mean, I think, Aubrey, you just mentioned, we cannot miss this boat. What does it mean to not miss the boat, in this regard? For example, I was thinking, many of the projects that, were previously focused on aging have now at least pivoted to some extent or spun out a few, let's say, COVID-related vaccine projects or something. Is there something the other way around where, things that are currently make sense with COVID could be extended, into more aging-related focus? So could we pick up people to where they feel comfortable in the crisis to opt in and then and then take them along? Or what does it mean to not miss the boat?
I could say something about that if you like. I was
Yeah.
talking. I was talking to somebody from Singapore who reads my blog, pinged me late last month because Singapore is having some open call for let's do something radical about COVID-19 through their rather baroque series of government funding and incentive and industrial and research institutions. And as you know, Brian Kennedy is now in Singapore, and Gero collaborates with Brian Kennedy, and they're now in Singapore. So I think the way that ended up after a little bit of hectic calling around and trying to figure out what the hell to do at the last minute, Gero is interested in senolytics, obviously, because as soon as you do anything that's a unbiased scan for small molecules, you're going to end up with senolytics, except now we know they're senolytics. So using senolytics against COVID is something that until somebody shows that it's stupid is probably something that all the senolytics companies are thinking about a little bit right now. And they are a nascent industry with a bunch of venture backing and the connection to the whole aging thing. So if it turns out that works, maybe they get some juice out of that.
Well, and I think, as Reason mentioned before, or Aubrey, or maybe both of you, that we sort of focus on trying to get more research done on the immune system. I think we just don't know enough about the immune system, and we need more funding for various companies like Reasons and others that are doing work on, experiments and trying to understand the immune system better. And that's directly related to COVID.
I mean, also the activation of autophagy would help here, I think. So, I mean, there are some studies that show that activation of autophagy helps to fight off viruses.
But how make a case for it? What narrative or what particular opportunities are popping up right now, if any, to...
I mean, with our autophagy company, we have applied for 3 government grants in that area. So that's how we make use of it.
That's also a little tough, given that everybody who's doing that now has to explain. If you're not in the immune space and you're doing autophagy upregulation, you can at least, pretend that Restore Bio was ritually sacrificed for some unrelated reason that has nothing to do with autophagy, right? But if you're in the immune space and trying to say, okay, I'm going to improve the immune system by upregulating autophagy, you now have a phase 3 trial failure for the most popular approach in that area to explain away, which is a little tough.
Aubrey, you also have...
I mean, well, actually, let me just deal with the Restore Bio thing. So it is, from a technical perspective, actually fairly straightforward to explain away that failure because of the restrictions that existed on the nature of the trial, on the nature of the endpoint, which do not exist at phase 2. But someone else is writing. Sebastian is writing the same thing. I don't really agree with Sebastian, actually. I think it might not have been such a garbage drug, but yes, the wrong indication. I agree with that. I've completely forgotten the other thing that I was going to say earlier in response to something that Reason said about 5 minutes ago.
What does it mean to not miss the boat? Is there any reason for hope? Are there any kind of shifts of mind that are happening, or is there any, I just remember, that effort, and I linked to it, also from the Google Doc, about trying to have aging classified as a disease, right? That kind of went somewhere, but what are there any opportunities right now that are popping up in which we could just make a strong case?
So I mean, I think Reason basically hit on the main things that we need to make happen. We need to make decision makers, policy makers realize that there is progress being made in both the academic sector and the private sector on improving the immune systems of the elderly, as part of course, improving the health of the elderly in general. And this work, therefore, has the potential right now to go a lot faster and be a lot readier for the next pandemic if it benefits from a relatively modest allocation of additional funding. Now, this is something that a strong case can be made for. If we try to make it today, people aren't going to listen because they're too distracted by the immediate problem. But if we wait too long, other people will jump in and make these people make their decisions, and they will be, and will be too late. So we absolutely need to be engaging these decision makers and policy makers and making sure that we are the people they come to when they do actually want to start planning for the minimization of the human cost of the next pandemic.
Yeah, thanks. Is there something to be said, about not talking to the regulators or policymakers or decision makers in that global sphere, but like, perhaps at least investors, who may have previously been skeptical could be onboarded quicker now. Have you seen any of this arising, or do you think that's a
John Lewis is certainly making hay on that front with his company, since he was ready to go with something virus. So now it's something COVID, and he's off raising money for there. I wish him luck with that. I think it would be a little disingenuous for me to take that approach when I'm talking about, hey, invest in this preclinical program that really is a next pandemic sort of a solution for. But certainly, yeah, investors have different motivations and different rationales for investing, and are in many ways easier to convince than regulators. The more important argument for going after investors, I think, is that in a world in which people only believe that in what exists, if you want to make change, the only way to make change is to build new technology and prove that it works. And investors are about the only people who are up for doing that. Regulators certainly aren't interested in fundamental research, and people who invest in public money are really not interested in fundamental research either. They want to take fundamental research that has been done and then do something low risk to develop it.
All right. Anyone else want to chime in? Sonia, Ole?
Well, I agree with what Reason just said. I mean, I think investors are the people in our society who believe in the possibility of creating a new world. And that's why they're doing what they're doing, because they love doing that. So they are the ones to target in terms of actually just creating something and moving forward. But we can't totally write the regulators off, because unfortunately they control some of the rules of the game as to whether or not these products get approved or allowed to reach the market. So we do need to interact with them. I was actually on a call yesterday with the National Academy of Medicine, and they for their longevity initiative. Some of you are probably familiar with that, and at least that's happening, and they're talking about it, but they're consumed with COVID right now too. But I don't think we can ignore the people in DC as much as people here. I'm in Silicon Valley. I mean, we would love to think that we could, but we can't, and history points that out many times.
All right, thank you. We're now at 10:02. I just want to say, as you make your final comments, we always try to kind of focus or end on a pretty action specific spot. So, what should people on this call right now do to allow us to not miss the boat once the kind of panic about the immediate pandemic is over, and people can start maybe worrying about getting ready for the next one, by doing something like preventative care instead. So what are kind of specific action items for people, who are on this call? If you want to kind of wrap up with that, and then I'll take questions.
Did we just converge on the answer to that question being giving money to me and Aubrey?
And also to Apollo.
I think Aubrey should write an op-ed about why we need the government to spend more of its research money on the immune system, on figuring out the immune system.
Mm-hmm.
So I think sorry, Aubrey, no, you go first.
Sorry, yeah, I'm not sure quite how the unmute thing is working. It seems that whenever I mute myself, I become unable to unmute myself.
Exactly.
But anyway, so I mean, in a way, I'm not the right person here, because let's face it, there is still a large section of society who regards me as both crazy and dangerous. And it is therefore, important for people who want to influence people like that not to demonstrate that they think I'm actually not crazy. I have deliberately avoided getting too involved in the National Academy of Medicine thing for exactly that reason. But the point is here, there are lots of people on this call, and indeed elsewhere in our community, who have good, friendly relations with very powerful people in the corridors of power. I, of course, do agree with Sonia and Reason that investors are very often more open-minded and easier to influence in relation to radical and innovative technologies. However, it cannot be denied that the government has a larger checkbook, and that, well, than most people anyway, because it can literally print money apart from anything else. So, any influence that we can have, even if it's a teeny tiny little amount of influence in pushing the level of emphasis of this or that thing in the direction we would like, that can make a big, big difference in terms of the actual dollar amount that is available to us. And of course, this early stage work, which is the high risk, most difficult stuff to sell, it is the least expensive, the stuff that actually takes the fewest dollars.
True, true.
Anyone else?
Yeah, so I would be a little bit more radical. I think that that's really the time that we should occupy the entire public dialogue about aging and about disease. And I think that we can, as a stereotype or idol, we can take other political movements. So, for example, the student movement in the 60s, which was about discrimination. They used a framework from Herbert Marcuse. And what they did is that they first framed the language and also the way how to talk about minorities. And then they were changing institutions from inside, and I think we can do the same with aging, right? So first of all, to make it very clear, to make an example. So for example, what all of us have heard in the last days or weeks is that a lot of people said COVID is not that bad because only the old died, and this is a natural thing. And what really everyone here on the call can do about it is to say this is discrimination against the old, right? And it's not like that all people have to die. It's not only destiny and doom, right? We can do something about it, and if we don't do something about it, it's a decision. It's a conscious decision not to help these people and not to develop these technologies. And I think this is really important that in every discussion we make the point, no, we can do something about aging, and we have to do something about it. We need more money, and we need policies to make that happen. But it's a conscious decision. It's not like that we are powerless here. And then, of course, through this discussion, we should also push the institutions in a direction where they make change. For example, what we try at Apollo, we are partly based in Germany, and we are in contact with our Minister of Health. He is interested in this aging thing. At the moment, of course, we can't reach him because he has other problems to solve. But as soon as this crisis is over, of course, we will talk to him. And we have talked, and one of the biggest rhetorical instruments we have is the reputation, right? We have to say it again, again, and again. And everybody in this call can do that. Everybody can make a clear point.
All right.
I think I would.
Thank you. Yeah, go for it. And I'm going to unmute Rachel next for her question.
Learn a little about the decay of your own immune system. I'm just going to post a couple of links in the. You can't be properly horrified and incentivized to do something about it unless you know more about what is going on, the utter disintegration of your ability to resist infection, and all sorts of other things to do with your immune system with age. I suggest reading up on it a little at the high level. Because it really
maybe
is.
You should give that to decision makers, just like, here, get personally scared. And that ties in nicely with Rachel's question, I think. Rachel, do you want to go for it?
Sure. With this panel, I have to ask, right? So assuming that each of you has a personal longevity practice, is there a practice or a set of practices you engage in that are maybe less obvious or less popularized? And are you willing to tell us about them?
So you mean supplements?
Supplements, exercise, fasting, products, I don't know.
Well, what I used to say was, I don't accept seminar invitations to dangerous countries. But at the moment, I'm not getting any seminar invitations, so that's a little bit moot at this point. But yeah, I wear a seatbelt, even in the back seat, even in countries where it's not required. At the end of the day, for most people, avoiding the risks of immediate or near-term death are more important because, we're making progress. And the more progress we make, the better. So really just doing what your mother told you to is the best policy right now.
Well, unless your mother told you to do calorie restriction, I'd say that calorie restriction is the thing to do. I'm the I'm the example of where that gets you on the grounds that genetics has nothing to do with the way I look for my age.
Yeah, I try not to eat too much, which is exactly kind of the same thing. Well, not quite, but.
Well, I would say if you do calorie restriction, you won't live forever, but it will definitely feel like it. I think Aubrey and Reason know the joke.
That's not a new joke.
It's not a new joke. So, I mean, what I do is intermittent fasting, metformin, resveratrol. I sleep enough. Sleeping is very important. It's a big risk factor for dementia and Alzheimer's. Try not to travel too much. And do sports. And vitamin D.
Good.
Everyone in the West should take vitamin D. But there's no magic to it. I mean,
Yeah.
you can also take aspirin, which gives you a little bit maybe of a longer life, but
Unless you're overweight.
yeah.
I think one thing that Aubrey often says to that question is like, it doesn't really matter. We won't leapfrog long enough to get us there. And it's kind of a distraction by thinking that we may actually kind of like do the whole thing while just taking supplements. No, we need kind of like breakthrough science to actually kind of like get us all the way. Is that still correct, or is it now just the thing this country's one? Okay, good. Then we have one last question by Adele, who was messaging me earlier with this one. Adele, I'm gonna unmute you to ask that question.
Oh, sure. Can you guys hear me?
Yep.
Yeah.
Oh, well, other than the problems you guys have already identified, what's a problem or a set of problems to which no solution exists right now, and something that keeps you up at night, like a juicy problem?
Well, it depends what you mean by a solution. If you mean, do we have a plan for developing a solution for such and such a problem, which is, 90% of the way to actually having implemented the plan, then I would say basically no. Every aspect of aging that happens, every type of damage that accumulates in the body throughout life and eventually contributes to ill health, we have a plan for repairing and eliminating that type of damage. But some of those plans are at a considerably earlier stage than others. The reason why SENS Research Foundation remains in its non-profit form is because some of these things are simply too early stage to be investable, even in the eyes of the very more early stage angel seed investor types. And of course, in due course, that may change, but at the moment, that's not true.
I would also say we are now at the point where we are coping with technical problems, and technical problems get solved at the end.
Okay.
Where the end comes is another question. I think the thing that keeps most of us who are not yet accepting of our mortality awake at night is that, hey, we basically have this. We basically have this down. We know where we need to go. It will just take a long time because getting humans to do things takes a long time.
So what really keeps me up at night is how do we get more money into the space? This is what keeps. And if you have the money, we will find the solutions, definitely.
Oh, yes.
How much money?
Billions.
Yeah, it's not trillions, that's for sure. At this point, I think I mentioned this earlier, the later stage stuff, which will probably cost, multiple billions of dollars to actually get through all the phase 3 trials and the building of infrastructure and so on, that stuff, we really don't need to worry about, because by the time these treatments get to that point, they will have been so comprehensively de-risked that getting people to write those checks of that size will be relatively straightforward. It remains the case that the early checks, even though they are smaller, are the hardest ones to get people to write because there is so much likelihood of the venture eventually collapsing.
But I mean, just to repeat myself, if you just look how much money went into companies like Airbnb, WeWork, Uber, if you would take this money and apply it to the aging space, I think there we go.
Yeah, I think you have to accept that it's only going to turn up after it doesn't make a difference. That's the way of large amounts of money. It's bootstrapping all the way up until it no longer matters that somebody throws $1 billion at the problem, at which point all of the all of the big altruists will start putting $1 billion into it because there's no risk in doing that, and governments will start belatedly supporting, commercialization, et cetera, But I think one has to expect it's going to be tooth and nail bootstrapping all the way through the stuff that actually matters.
I'm really sorry that we're over time, but like one thing that popped up in the chat, which is someone mentioned that Bezos and Musk aren't totally focused on aging, and you could make the same case for Gates, even though he's stepping up on different angles. Why do you think that is, and like what pitch are we make to the billionaires?
I think some of the billionaires have the same problem as regular people. I mean, I remember being at a dinner with Bill Gates, and my book was just coming out, my book 100 Plus. And so we started talking about longevity. And Bill Gates got really angry, like aggressively angry, saying that anybody who was trying to stop aging was some sort of immoral person because they just wanted to live forever and they didn't care about all the people dying in Africa. And that was it. And he was just angry. And it went on like that for an hour or so. And, it's like, so, Bill Gates wasn't immune. I think he's changing his tune now that his father has Alzheimer's and he's starting to see the end of the rope coming for him. And, I think that's what it's taking to change his mind, unfortunately. I think Jeff Bezos is a bit more enlightened. He sees that a little earlier, a bit more of a visionary. But still, he's interested in other things like going to space because that's really cool and it's fun.
Well, in my experience, every billionaire is different. Some billionaires are just like Bill Gates, and as Sonia said, are just not knowledgeable enough to understand the basic concept that aging cannot be divorced from the diseases of old age. One very popular thing, which Sonia highlighted, is that people are, what concentrates people's minds is the state of health of their loved ones and not a lot else. I met Sergey Brin in 2003. He's never given us a penny, but of course he did write a large check to the Michael J. Fox Foundation about a week after discovering that he had a genetic predisposition to early onset Parkinson's disease. Jeff Bezos, I met at TED in 2005, I think, something like that. Met him several years thereafter, and every single year he would take the initiative to come up to me and ask me what was new, what was going on. But he's also never given us a penny. Maybe some people don't do it because their wives don't want them to. I know that's true in some cases. Some people don't do it because they think it'll hit a share price. Everyone's got their own reasons, but they're all completely crazy.
I think, just circling back to our conversation earlier on, this goes down to what motivates people. And honestly, it's not, as much as I would love to think it's because, with COVID that we're all seeing that everybody cares about the elderly, really it comes down to personal, people are self-centered and they're worried about themselves. And to the extent that we can make individual people realize that fighting aging is in their self-interest, then our movement will move quicker.
I think it's enough to remind people that they have parents, because people who think that it's okay that all people die, they are not okay with their parents dying. So this is already a strong argument. And this argument is so stupid to say these are all people and it's just natural that they die. So
yeah.
All right, thank you. Well, that's a strong push. Okay, thank you so much. Thank you for staying 6 minutes over time. I really, I am very grateful that you joined for the session. I'm hoping that maybe I'll post some links afterwards and bring you up to speed. I actually really like the point about make it about your personal health, like the point that Reason made. Read up about how fucked up it actually is, this process, and that we could actually do something about it. So getting people to, put on their own masks first, or to realize their own mortality first, and then maybe that would be a good point for them to chip in. Thank you so much for joining. For whoever wants to stay on, we're going to do more of a participant-based sharing of your guys' bits of hope and things that you've taken away from this. And for now, I thank the panelists so much. You're obviously also welcome to stop on, but I want to be very mindful of your time. Thanks a lot. I'll be following up. Please send me things that you want the participants to know. join the Slack channel, please, where Ole and Wiesn are already in. Say hi to participants, and yeah, thank you so much. It was really a pleasure, and I think, quite hopeful. We just have to keep pushing.
Thank you.
Thanks, everybody.
Bye, guys.
Thanks. Bye.
All right. And I'm seeing every time here in the chat, please save the chat. So we'll definitely do that too. I do want to keep the chat a little bit more informal. So hi everyone. I think I think we already posted the video from yesterday, which a lot of you guys afterwards requested. I think that was yesterday so far was the favorite one for many of you here. Maybe we could top the one. We could top that with today's salon, but I already posted that salon from yesterday. But it's cool that we even have Jim here in this chat right now. So maybe to speak with a few participants, please raise your hand if you'd like to kind of like share your bit of hope. Like, what makes you particularly hopeful right now? What have you recently realized? This could be like an observation. This could be something that you read. Or it could be something that was always on your radar that actually will emerge a little bit better and stronger after this crisis than before. Feel free to raise your hand right now to share. Given that we have some participants in here, maybe some of you will also want to sneak in another question if you want to. But this is the stage for you guys to share. Please raise your hand right now if you'd like to have a go. All right, everyone. Okay, we have a few. Okay, Edward, I'm gonna unmute you for now.
All right, am I unmuted?
Yep.
Good. Yes. Hi. Hello, everyone. The one thing that I get some optimism from is that I'm in the Washington, D.C. area, work for various private think tanks, and over the last 3 years especially, I've really been pushing for Food and Drug Administration reform, which in 1992, the FDA was kind of forced to create a parallel track for AIDS patients to get early access to medications that had passed the phase 1 test and were still in efficacy tests, because people suffering from AIDS didn't have years and years to wait. And it turned out to probably have saved at least 12,000 lives. And we've been pushing for this kind of reform for the last 3 years at various congressional offices and so on and so forth, kind of getting a fairly positive reaction. And now with what's going on with the virus, we're expecting that afterwards we're going to get an even bigger reaction when we say, look, we have to try to do something about this somewhat antiquated system and come up with ways of testing and so forth that are appropriate for the 21st century. I know, Aubrey, you mentioned about the problems when you get to phase 3, right? And about the endpoints. And that's one of the things we've discussed kind of that nobody ever reads about in the Washington Post or the New York Times. But I think those sort of issues are going to be on the national agenda. I want to mention one other thing that kind of came up in this discussion about how to sell ideas and get ideas popular. I've been giving talks, and I know some of the folks on here might have been in some of them, Gennady there and so forth. I've given talks to college kids in the DC area here and in Baltimore, and to like the Republican women's clubs in the area, which are, let's say, older people, about you can live to 200. And I go over some of these stuff, some of Aubrey's stuff and so forth. And from both audiences, I get, wow, I didn't know that was possible. I didn't know this kind of research was going on. Can you give us more information about it? So I find the fact that you can go to young people in college and a bunch of old, very nice Republican women in the suburbs of Baltimore and so forth is very promising for the future, and about how we will raise this issue to a higher level after the virus starts to subside and people start to say, hey, look, wow, this is really possible. And now that we've had this death scare, hopefully not too many more people dying, I see this as a great opportunity to put this on the national agenda.
Aubrey, want to comment? Otherwise, I'll take the next participant.
Yeah, I basically agree. Let's keep going.
Great. Gennady, you're unmuted now.
Thank you. So my bit of hope is that I do believe right now, in the wake of the COVID-19 pandemic, it may be possible to persuade policymakers, at least in some countries and some parts of the world, to declare aging a disease. In fact, the US Transhumanist Party is spearheading an initiative to do that in Argentina. And this initiative has made some headway. Our foreign ambassador in Argentina, Dr. Christian Menu, had a successful meeting with the Undersecretary for Public Health in Buenos Aires, and it is going to be escalated to higher levels of the Argentine government, both in the city of Buenos Aires and in the Argentine Congress. So I think there's a potential right now for a domino effect of sorts to occur. If there's even one country anywhere in the world that declares aging a disease, that will turn heads. And other governments of other nations are going to ask, well, what is this all about? Why are they doing this? What is the relationship to COVID-19? Can we do something similar? Can we attract research and investment? Can we leapfrog ahead of these ossified, established Western countries and become the next mecca for scientific research, especially in the field of longevity? So that could be a way to go. And I would encourage everyone on this call to add your names to this statement. I'll link to it once again, because this is something anyone can sign. We've had nearly 100 signatories already, and some of them have been leading researchers as well as thinkers in the transhumanism and longevity fields.
Yeah, so am I mute? No, I'm there, yes. Yeah, Gennady, thank you for this. I haven't actually read the declaration yet, and I'm going to do so today. I mean, I think it's important in any such initiative to recognize that we need to generate global momentum here. So I would very much hope that the declaration has some kind of recognition of the progress that's been made elsewhere, especially in the US with the TAME trial, with the FDA's recognition of the legitimacy of a clinical endpoint that is a combination endpoint, which kind of encapsulates the interaction and the relationship between aging and the so-called diseases of old age, because that really is the number one thing that needs to happen in terms of a definition. What needs to happen in terms of action, I would say, it really grows from that. It is that people need to be thinking of the entire ecosystem of health problems late in life as a medical problem that can be addressed in a manner that's not just one disease at a time. And if the declaration can encourage people to think in these more holistic terms, not to go all the way to thinking of aging as a single unitary phenomenon, but nevertheless definitely to recognizing the practicality of interventions that can address multiple age-related conditions simultaneously. Of course, this can draw on a bunch of things that are already happening, not just in the laboratory, but also in the clinic. And because it's still early days, especially in terms of clinical interventions, there's a lot of people who haven't heard it. So yes, this message can definitely make a difference.
So I was thinking that that's actually I think an interesting point, especially the global focus, right? Given the fact that after COVID-19, governments are somewhat in a competition to who appears to be better prepped for the next pandemic, right? It's interesting because in a previous salon, we talked about the fact that how can we avoid the mistake of just prepping for the next pandemic, right? Rather, we should become generally more anti-fragile as a civilization against a variety of different risks, not just the next pandemic. But here we're even talking about the fact that, just the fact that people will be gearing up to at least look like they're doing something to be better prepared for the next pandemic, right? That could be a really good point in kind of creating some perhaps regulatory competition across different countries to be opting into those more longevity-focused interventions. If that's the case, which countries or which nations do you think could be perhaps more promising to target in efforts? I mean, generally you were mentioning Argentina, but are there any other countries right now apart from the US that that would gain a lot by seeming like they're really prepared for the next one?
Small countries. I think that we are definitely seeing an opportunity for micronations to exert a lot of influence, because micronations have a lot more political influence than their size would imply. I'm talking about, well, let's say in Europe, countries like Monaco and Liechtenstein and so on. And it turns out that such countries, first of all, they tend to have an unusually old population. These countries tend to have been hit the hardest by COVID-19. I think San Marino is actually the country with the highest per capita death rate in the world. These countries can exert that diplomatic influence if they want to punch way above their weight. And they listen to people, they make decisions much more quickly than large countries with large bureaucracies. So I think there should be a lot more emphasis there. This is actually happening already. Liechtenstein is a country that has taken an initiative at a very high level, convening a couple of roundtables to advise it on what to do. Monaco and San Marino, I've been in contact with senior civil servants like health ministers and so on at these countries, which I could never get to in Germany or the UK or anywhere. So yeah, that's a big possibility.
All right, thank you so much. Then we had another question here in the chat. Trying to find. Okay, Vincent Weiser. Vincent, is it okay if I unmute you? Then you can ask the question yourself. I'm unmuting you right now.
Hi. Yeah. So my question was basically in the direction of if there is maybe the need for a better public narrative around longevity. One example where, for example, friends of mine came to me to longevity was on Netflix on Explained. They had a series on aging, but it was like very short one, which is more on the documentary side, but also kind of like more like a media narrative in the direction of space movies, for what space movies helped achieve for space colonization.
I would love to see science fiction work better in this regard. Many people have noted, and it's very true, that there are hardly any science fiction movies or books these days that represent a post-aging world in a positive light. There used to be some, of course, in the 50s and 60s, but dystopia seems to sell, and that has become a real problem. I've thought of a couple of plot themes that could be used in science fiction to change this. Nobody's picked up on them yet.
Can you share them? Like, do you have them written down, or?
Well, okay. Here's my favorite one. I think we should have a movie in which which begins by looking at a post-aging world that has existed for a while and everything's working fine. And the dramatic element in the movie and all the plot consists of, near the beginning of the movie, aging comes back. Some infection comes along that causes the re-emergence of the chronic progressive conditions that we're familiar with today. And of course, because people have become comfortable and familiar with a post-aging world, they don't have a problem regarding this as a medical issue. And there's a lot of desperate, humanity mobilizes itself against this problem and eventually prevails again, and aging goes away again. So that's the kind of plot that I would like.
What do you think about just turning the Fable of the Dragon Tyrant or something into a movie?
I wouldn't say no, but I don't think it has enough to it. I think that it only addresses one component of the issue, namely it focuses people on their own irrationality about aging. I think what we want to do is focus people on their irrationality about the consequences of not aging, the excuses that people make for making aging a blessing in disguise, which are largely at the social level. I mean, it's no accident that the erroneous assumptions that are introduced at the beginning of the typical dystopic movie about a post-aging world are sociological ones, like, we've got too many people, we have to shoot everybody at the age of 30 or something like that. these are ultimately not ethical, they're not philosophical, they're sociological. And I don't really think the Dragon Tyrant story, wonderful though it is, directly addresses those. So it may not be the most ideal, most effective way of combating and counteracting the problem we have today.
Well, but like what the one that you mentioned, I think, is doing is like it makes people at least see that at least the societal carrying capacity of the earth and whatnot, that could be overcome, that there's no problem there, but it still doesn't tackle, I think, the thing that you thought was most important in your reasons for why we're not making progress, which is the hope, the fear of having your expectations be thwarted by not being able to do it. And that's what the Fable of the Dragon Tyrant immediately does, it's a very...
Yeah, you make a good point, Allison, and I certainly don't, we definitely need both. Someone on the chat has just written that it would be good to have an animated short film about the Dragon Tyrant. That's actually been done. There is an animation. I forget, I don't have a link to it myself, but I've definitely...
It's on YouTube. Right. It's on YouTube. Yeah. Yeah, okay. I love that scientific plotline. Do you have another sci-fi plotline?
Not as coherently articulated.
Okay, well, this is amazing. I would like, and you even have this catastrophic element of aging comes back. Okay, that's lovely. Let's see. Was there any other question from the panelists? One thing I think that you and I discussed once, Aubrey, was trying to do something not really like in a sci-fi way, but more something similar for policymakers, where it wouldn't be specifically fiction, but like giving them easy ways in which they could see that actually a future in a post-aging world is a really positive one, and that all of the collateral kind of like problems that people are worried about, like carrying capacity and so on, are solvable, right?
Yeah, I think the emergence of the private sector in this space matters a lot for that, because at the end of the day, the main people we're talking about when we talk about policymakers are elected representatives. We all know that elected representatives have exactly one priority in their lives, which is to get re-elected. And they also know that the way to get re-elected is to make people feel wealthier. The aphorism that it's the economy stupid is just as true now, and it's just true everywhere as it was when Clinton said it. So that means that when people who want to make money, investors in other words, start to take a new idea and a new field really seriously, policymakers listen a great deal more than they listen when people like philanthropists or even scientists get up on stage and on camera. So I think we need to leverage that. We need to get people to understand that the fact that the emergence of this industry is a kind of a real signal that there are going to be votes in this very soon.
All right, sweet. Thanks, Aubrey. And then we have George. You had your hand up. I'm going to unmute you now with a comment.
Thank you. I wanted to check and see who is doing the best work on the environment and human health, the health of the environment and the health of the human, and how both can thrive and live as long as possible.
Do you have a suggestion, George? I think that's your focus area, right?
Yes, I work with the Buckminster Fuller Institute and with the Walter Munk Foundation for the Oceans, and we're seeing how all these systems are interrelated. And I was just wondering if that was looked at. Maybe Aubrey, you have an idea of who is working on environmental health, human health interface?
Well, okay, there's a couple of answers to your question. First of all, yes, a lot of people do take the environment seriously as a contributor to the rate of aging. But in general, this is a bit of a distraction. I'm not saying it's 100% a distraction, but the impact of the environment on the rate at which the body accumulates molecular and cellular damage is really small in most environments. Of course, there are extreme examples, outlying situations where there's a high toxicity. But the amount of damage that you do to yourself by choices of what environment you surround yourself with is a tiny fraction of the rate at which you damage yourself by breathing. Breathing is by far the worst thing you're doing for your health right now. And, it's rather non-negotiable. So, we need always to have a sense of proportion about this. However, in the context of the discussion we've been having over the past 10 or 15 minutes, I think it's very important to recognize that a lot of people, when they want to find some excuse for aging, some reason why aging is a blessing in disguise, they will talk about the environment. They'll say, oh dear, we've already got too many people, this would be terrible. And so one does have to combat that head on. One can't just sidestep it and say, oh, don't worry, we'll all go to Mars or whatever. One's got to say, look, actually, the technologies that are also being developed right now, whether it be artificial meat or renewable energy or desalination or whatever, these technologies are going to be addressing our existing environmental problems, but they're going to be more than addressing what we have today. They're going to be going further, in other words, increasing the carrying capacity of the planet far more rapidly than the population will increase as a result of eliminating aging.
Thank you.
Yeah. Thank you, Aubrey. I'm posting to everyone, I'm posting a link right now to our technical competitions. In those we always try to bridge two scientific silos to make progress on a crucial feature in a positive future of humanity. We focus on planetary health and human health. And so, we haven't tackled them together yet, but there's definitely atomic precision for human longevity and human health span. But then we also had a technical competition last year, which I encourage you to check out on the same feature with. Oh, hello, can you hear me? I don't see my video right now, but I think you can hear me. Oh my God, man, I'm definitely breaking up. But we had one as well on human health, and we had one last year with Tom Chi from Google X on atomic precision for leveraging planetary health. So I encourage you to check out that paper. We have a few proposals there. I do want to say that I think. One thing that Aubrey often mentioned, and I think that's a really practical thing to think about it, is that, we have talked so much about self-interest today, right? And if people realize that they could live longer, they would also care about longer time horizons. And longer time horizons, the first thing that hits you right in the face is climate destabilization, right? It's not something that we have to figure out for future generations. It's something that will bite us in the face if we are lucky enough to live long enough that it becomes a problem. It's already a problem now, it's just distributed, but I think it's a really good way to make people have skin in the game, to care about those long-term issues, which are very, very climate related. So I think it's a good segue into that. All right, cool, we're at 12:29. This is it from our end. Thank you so much for joining today, for staying on for so long. Again, Aubrey, as well to you. I'm glad I reminded you about the talk that you have tomorrow, so you won't miss it. And maybe people here can join that one too. Maybe I'll find a link to it and post it. Thank you so much. Tomorrow we're going to talk about contact tracing technologies. So we're going to tackle a different type of tech and how that could be expanded outward to actually allow people to coordinate much more richer in decentralized way than we may have to get around just to do contact tracing in privacy preserving ways. So we're going to focus on a different angle there, but I welcome all of you to join the Slack discussion if you want to. The link to join the Slack is right on the top of this chat, and it's already a really rich discussion over there. Please join, and please help me collect action items. When I'm moderating, I find it sometimes hard to keep track and jot down specific action items. So I asked in the HiveMind weekly 2 discussion on Slack, if people could help me keep track of action items, just post them there. And I think someone made a Slack channel right now on upvoting questions for the next discussion tomorrow. So I'm going to check in that one too. For now, thank you so much for joining. Thank you all for joining again today. Again, if if you're interested in supporting the work that we do at Foresight about kind of like pushing on a variety of different angles about different future-facing technologies, because they are all like one thing that I think that we realize at Foresight really well is that it doesn't require one particular thing. The future kind of is a really large place, and a lot of different things have to go right, and a lot of different ways can interact in mutually beneficial ways with each other, right? That's why we do those technical competitions at the intersection of different technologies. If you're interested in supporting this kind of effort, right, it's a large coordination game that we play. We definitely reach a lot of different topics, but I think they ultimately all interdepend on each other. if you're interested in supporting that, please go on our website. There's different membership levels associated with different benefits. Please feel free to donate. We really appreciate you guys' help. Thank you so much for joining today, and I hope to see many of you tomorrow. Thank you so much, Aubrey, for sticking it out for so long with us. All right, bye guys, have a lovely day.